press dropped last night around 7:30. Dr. Annette David now. She was in the public health press conference, Doc, but obviously this message came out after that. So I just kind of wanted to maybe go into a little bit more of what the governor had said. And I think it's a little bit of a hard sell because just mentally, when we see these crazy case counts, and I'm talking like, I mean, we used to think like 115 cases was, you know what I mean, crazy. But I think people are just really, and myself included, having just a hard time accepting that these case counts are, well, acceptable.
Yeah, I know. It requires a mental shift, right, Chris? But here's the thing. This is a rapidly evolving virus. It's highly adaptable. And that means that for us to be able to address it effectively, we also have to be very rapid in terms of adapting our mental models around it. And I like to sort of think that this new variant, if you think about the ancestral strain, and Delta was kind of like the Hulk, right? It's big and it hits you hard and it's very severe. Well, Omicron is kind of like the Flash. It's not that heavy of a hitter, but it's very fast. And so it affects a lot of people very quickly. And what the governor is really trying to do with her team is prevent a public health emergency for the island. And if you ask yourself what constitutes the emergency is if you overwhelm the hospital systems, the clinic systems, so that there is no safety net to help people who are sick. And that includes not just people with COVID, but the other diseases that haven't gone away. So you need to have that health system in robust and in place, and you want to avoid overwhelming it. If you look at Omicron, the important metric here is the hospitalization rate. And if you look at it, even if the numbers of cases are high, there's a lot less people going into the hospital. So what this means is that people are able to tolerate the infection more. Many are in fact asymptomatic. So I think maybe that's the sort of mental shift we have to make to adapt to this new variant. Does that make sense?
It does, Doc. But so we've been in this surge. In your opinion, I guess, how long do you think we've been in this particular surge?
Oh man, you mean Omicron itself?
Yeah.
Well, if you look at the numbers started going up shortly after Christmas. So personally, I think maybe somebody brought it home, with the Christmas presents, and it's just so fast. Like I say, it's like the Flash. It's so fast. It just spread and hit a lot are very quickly.
You were comparing, like the Delta to the Hulk, and like now Omicron to the Flash. But are there advantages at a macro level to a virus like just spreading insanely quick through a community of any scale, rather than going over like 4 or 5 months?
Yeah. Well, remember we were talking about viruses, right? And their key mission in life is to live, to survive, and they need the host. And so if you can infect very quickly, very efficiently, that grants you a survival benefit. On the other hand, if you infect many people very quickly, two things. One, it makes the people who are unvaccinated, it makes them rethink their decision and kind of prompts them to get the vaccination. And then those that it infects, it helps to create the sort of natural, what you call the disease-related immunity, not as robust as vaccine immunity, but it does provide you some protection in the short term. And so what happens is you end up with the population hopefully becoming a little bit more resistant, unless there's a new variant that emerges that is able to bypass the immunity that we've created. Right. So it's really a race. We are trying to get to a point where there are no vulnerable people for the current virus to infect before that virus mutates into something that can bypass all the immunity we've gathered so far.
Yeah, and I mean, I'm sure, Doc, about I don't even know if COVID fatigue is the right word for it, but when you talk about it's a race to just get everybody as much protection as we can, you're talking about vaccination and boosters, and then there's that side current conversation where it's, oh my God, the first booster is going to be the second one, the third, and then pretty soon we're going to have like 10 boosters.
Well, There's actually very new data coming out from Israel because Israel started doing the fourth dose, the second booster in people over 60 and the immunocompromised, and they just published results of their data yesterday. And it really showed that the fourth dose, the second booster, a little bit, but not a lot. Not a lot. So
I'm sorry,
I think
Doc,
now the
Doc,
state of the data is what we have.
I'm sorry, Doc, you kind of lagged on that like really important part, and we didn't get any of it. So you said Israel has been doing the fourth or the second booster for 65 and over, but the data found what exactly?
Oh, okay. So they've been doing this for people 60 and over. And what they found and what they shared yesterday was the second dose of the booster. So this is the fourth dose, right? It upped the immunity a little bit, but not very much. So currently, with what we know from the global community, the regimen we have, 2 doses of the vaccine and the booster, the 3 dose, all in all, seems to still be what we need to aim for.
Doc, when I was watching the live stream that you were a part of yesterday, fascinating material, first of all. Like you were, and I wanted to kind of maybe touch base on the use of the mask and maybe more importantly, the misuse of the mask, right? Anyone that's ever been part of like one of your lectures or a live stream, they know you're very engaging and, you're a very compassionate physician, but I would say you were kind of uncharacteristically almost to the point of emotionally being like upset yesterday when you were talking about the way people are misusing them, whether deliberately or whether they're just accidentally, specifically when people pull it down and their nose is exposed. Can you talk about why that's such a big risk?
No, absolutely. I mean, the mask is a barrier. It's supposed to prevent you from inhaling any virus that's floating in the air. So it can only protect you if it forms that good barrier around your mouth and your nose. And so when people are not comfortable with the mask that they're wearing and they're constantly tugging and pulling it down, the moment you tug it down, you've lost the protection. And so you've opened yourself up to infection. So people talk about, well, should we be mandating the N95s and the KN95s? And the point is that the best mask is the mask that you will wear correctly and consistently every time you're in public.
And now after you said that, I was like, yeah, I kind of paid attention when I was on my way home yesterday, and I was like, wow. I didn't realize how often you actually see that people walking around like on the street, they may, just pull it down or something like that for whatever reason. They're probably not even aware that they're doing this or that they're actually making more of a problem.
Yeah, exactly. I mean, some people like myself, I wear glasses, and sometimes your glasses fog up because of the mask, or for some people it's very uncomfortable, or when it's hot, it makes them sweat. So they're constantly taking it off to cool themselves off without realizing. Every time you do that, you are basically saying to the virus, come and get me.
Come and get me. Doc, but so we're on the N95 thing now because of the latest guidance that had come out. But man, this thing is killing my ears, Doc.
Yeah, same with me. And and when I was still doing clinical practice, we used to have to use it in the hospital. The point is, in terms of levels of protection, the N95 and the KN95, they give you the best protection. That's the highest level. But the big but is only if you wear it correctly. And that means it has to have a complete seal around your nose and your chin. That's because those masks, they're actually respirators. So Jason, you mentioned it's what the painters wear. Correct. These are industrial grade respirators, meaning that they're made of a fabric, and the way they work is when you inhale, there has to be a complete seal around your nose and mouth, because when you inhale, the air needs to go through the fabric and get the filtration that the fabric provides. If you have any gaps around your face and the air goes in through the gaps, you've not gotten the filtration and the protection that you need. So that's the key to those masks. You have to have a complete seal around your face. And if you have facial hair, if you have any sort of oral prosthetic, right? Or sometimes if you just have the sort of deformity or irregularity in your face that prevents the mask from giving you that complete seal, then it's not giving you that level of protection you expect.
Doc, I feel a little attacked, but I just got to say in my defense, I just have a thick face. So I'm just juicy up here. That's all.
Okay, just let me say, maybe for your dating profile, you
Yeah.
want to add have a strong chin. You know? Let's put a positive spin
Right
on
on,
this.
Jay.
Yep. Well, Dr. David, one other thing that you mentioned, you spent considerable amount of time in this in your presentation yesterday was, I know the market for masks, like in the last 2 years, has like really taken off. And you go on Amazon, there's like 400 different vendors offering 1,000 different masks, right? But the one thing that you were actually, I guess a myth that you were trying to put down was the types of masks that have ports in them. And you're like, Joser, over here, like our technical director, he actually had one from a couple of years ago that had like a little filter in it, and everyone was like, "Oh wow, you know
Yeah.
that's a wonderful use of technology."
That's the
but-
Bane mask.
Yeah, exactly. But you're saying those are a no-no.
Yeah, don't use one with a port. And the reason for that is there's no filtration through the port. So if you were infected and you're producing that virus, you know, because part of the mask is two-way, right? It's supposed to protect you from the virus getting into you. But if you're sick, you also wear the mask to prevent you from pushing it out into the environment to other folks. If you have the port, that protection level is gone. So if you were sick and infected and you're using that mask with the port, thinking you're preventing the virus to get to the rest of your family, for example, then that virus just slips out through that port because there is no filtration at the
Right.
level of the port. So avoid anything that has a port in it. What you guys are wearing, that's the right one.
Yes.
Thank
I
you.
think we're gonna do some kind of like fashion show, like oh.
I know, right?
I hope it's the right one because I feel like I'm about to Van Gogh both my ears with this thing. It's so tight.
It's not easy to wear, that's for sure, because you know it needs to create that tight seal, and so the pressure on your ears or on your jaw and your face is quite significant.
That's
Now,
why they
you were-
pay
you were sa-
doctors the big bucks. They got to wear this thing.
Yeah. Now you were saying, doctor, that in the medical profession, there's also an alternative one. Like if you're having, like me, like I've been wearing this now for about like 6 hours, and it's been pulling on my ear so much, my
Right.
jaw hinge is like a little bit sore. I mean, it's not excruciating, but I can feel it's a little sore. You said there's actually one that can actually wrap around the back of your head.
Yes, there is one. There's a model by 3M. I don't know if you can see this.
Okay,
But
yeah.
Yeah, so it just goes around the head,
Okay.
2 straps.
Okay,
that
and
make-
I don't have a ponytail, so that it messing up my hair is completely fine with me.
Right.
What
But
questions?
you'll be surprised, it is a fashion accessory in the Philippines. They've done everything. They bead it, they put jewelry or whatever. It matches your clothing.
There
it's
you go.
amazing.
we can, hey, as long as it doesn't have a port, you can bedazzle your mask. You can,
Absolutely.
there you go. What
Bejeweled.
in the last week, especially because we've seen so much dramatic change, maybe in the last 10 days with case numbers and, but like you said, the hospitalizations have stayed relatively low. What questions have tended to bubble up for people in your line of work from the general community and maybe like even in the medical community about just concerns? And like you said, the numbers and the metrics we're following have basically been the same. It's like number of positives, total number of cases, number of hospitalizations, but the importance of those have kind of like shifted in this surge.
Right. A lot of concern about what more can we do. And right now, we know what we have to do. I mean, the biggest risk factor is being unvaccinated. So if you're not vaccinated, get the vaccine. If you're ready for your booster, get the booster. And the same things we've been doing this past 2 years, the physical distancing, wearing the masks, the hand hygiene, the ventilation. I mean, I think the key message, and the governor is completely right, we just have to hang tight and just keep doing everything that we've been doing and just hope that we are closer to seeing the end of this pandemic and get into the transition period where this becomes endemic and just part of normal life.
Doc,
Would you-
I just wanted to ask though, because in the message the governor says stay the course, but what'd you say to those people who look at these high case counts and say, no, we shouldn't? Well, I'm like one of those people. We shouldn't stay the course. We need to do something better or do something safer.
And what would that be, Chris?
I don't know. I mean, a limit social gathering or something. I'm just saying, like,
Well-
and I understand that this has been deemed acceptable, right? But I would just say, I mean, a responsible message would be maybe not keep on keeping on this way, but more promoting responsibility and safety, I guess. Yeah.
Yeah, I think it depends on the, yesterday I was talking about the fact that COVID is not a single point phenomenon. It's not that you don't have it this moment and you have it the next. there's a process that you go through, so you need to be exposed first. If you're exposed, you need to get infected. If you're infected, you get symptomatic, and if you're one of the unlucky few, you end up in the hospital, right? So the lockdowns and the social gatherings, they are effective at the point in time when the virus is not widespread in the community. Because the point of all those interventions is to prevent exposure. They're supposed to keep you away from environments where the virus abounds. But virus is everywhere as it is now. I mean, if you look at it, where are people getting it? They're getting it at home. So, what would the lockdown do in that point? It's probably less effective at this point. What's really important now is to make sure everyone gets the vaccine, everyone's wearing the right mask correctly and consistently. And then if you do get infected and you're at high risk, get tested so you know, and then get the monoclonal antibody or the antiviral so that you're protected from the hospital. So we've shifted already.
Right.
In that continuum.
Right, Doc. I also wanted to ask about the what you had said about, and the governor said it too. Even with these, what was the word she used? Alarming case counts, we're still protected, right? And it kind of seems almost like an odds game where you have 700, 800 positives, and then I'm just thinking like of those. I mean, is it a given that a certain amount will end up in the hospital? Because it kind of seems, again, when you talk about mental shift, right? When we know that 115 positives before was like, ooh, bad. It's just still hard for people to accept that this many is acceptable and that it's not going to translate into hospitalizations at a level where it becomes a big issue.
Yeah, well, no, here's the thing, right? I mean, what you want to keep an eye on are the folks getting into the hospital, so the hospitalization rate. And that's normally, right now with Omicron, it's a much smaller proportion than it was with Delta. But if you get many people infected, if that total number of cases is very high, even if that proportion that going to the hospital is low, that will still translate into large numbers of people. So like 2% of 1 million people,
right.
That's still quite a lot, right? So the attitude that, oh, it's okay for me to get infected, that's not the right attitude to have. We still have to try and break the transmission cycle. And that's where the vaccination and the masking come in. That's why they're so crucial. I know we're tired, but we just have to just keep at it until this thing is gone.
Doc, also the Gov had talked about nationally the trends with Omicron, and it is a little confusing because we did, of course we're going to Google it, and it really depends, I guess, on where you look into, because some places in the States and around the world are really having the hardest time with Omicron, others not so much. And I think the difference is, when you read a lot of these media reports, is the vaccination rate. So are we of the thinking that because our vaccination rate is so high that we're more likely going to go the way of these places where it is fading and not the way where it's, the COVID nightmare all over again?
Ravaging us.
Yeah, that is certainly the hope and the thinking. And I personally feel that the high rate of vaccination is cushioning us from some of the more severe consequences of Omicron. So if you look in the US, it's the big cities are the ones that are now showing the decrease, right? And they tend to be the ones with the higher vaccination rates. It's interesting because I was in Boston for the holidays. What they do is they follow the wastewater. They actually test their wastewater for the virus.
Right.
And what they're seeing is when the wastewater levels go down, then the case counts follow about a week after. So that I thought was an interesting thing. And I know we did a pilot here in Guam last year, but I don't think they've been able to procure the equipment to continue doing that long term. That might be a worthwhile investment if we want to keep an eye on this virus in the future to see, if we can forecast when mini surges happen.
What is it? Explain that, Doc, because, okay, what goes down the toilet can predict a COVID surge? How so?
Right, which makes sense because if you're incubating the virus, when you evacuate your waste, the viral particles go with it. So it becomes a good, or in a sense, it becomes a useful indicator of how high the infection burden is in the population before people start manifesting symptoms. So I thought that was interesting. That's what they're doing in Massachusetts now.
And that's fascinating, and
Yeah.
obviously
No, we did.
that's a larger sample size than saying trying to make a whole bunch of like an entire metro level city trying to take like a survey or something like
Right.
that.
Exactly.
Or it gets
Yeah.
stopped.
Exactly.
I mean,
Yes.
is there any better representation of a community than its wastewater? I mean, it
Yeah.
sounds weird, but
It does.
Yeah. No.
And Doc, you're
So-
right. We interviewed somebody about this last year, but we did. What happened to that on Guam?
I think they did the pilot to see if it was feasible, but again, we didn't have the. So I had to send the samples off island, and I'm thinking that might be a worthwhile investment. I mean, we have an excellent the Weary Center is excellent, and GWA has the capacity. So if people wanted to invest in that equipment, this would be a good way to track not just this virus, but maybe other viruses, other illnesses. It might be a good way to predict, when to expect any sort of crisis or surges in these diseases.
Doc, could you talk a little bit about test kit shortages? Is that happening nationally, and are you hearing anything locally? Because we've just heard from like the schools and some of the businesses that they're running low, and that there might be an issue in replenishing their supply. I'm just not sure. So.
Well, it's demand and supply, right? Yeah. And then the demand is very high right now, so the supply needs to keep up with that. And I know I've heard Fernando Estevez say that Guam is we're always putting in those purchase orders, but the reality is we don't have the purchasing power of, say, New York or California, so we're constantly competing for that supply. That being said, I guess the priority now is to get tested if you're symptomatic. If you don't have any symptoms, maybe you can wait a bit, if there's not enough to go for the community. The key is to identify those who are symptomatic, because those are the ones who would be at higher risk of ending up in the hospital.
And again, I just want to echo the doctor's sentiment, because Joseph, if you can bring up that graphic, the Dedido and Inalahan public health centers are available from 9 to 12 today. If you do need to get tested,
Can you give the number out again, Jay, just real quick while
Sure.
you're talking about this? Because that guy called and wanted to get the number.
Okay, and it is if you are symptomatic, like Dr. David said, and if you do need to make an appointment. So the number is. Here we go. Okay, Joseph's got it. So 635-7525 or 7526 for the Dedido Public Health Center. You do need to make an appointment from 9 to 12 today. And down in Inalahan, 828-7604, 828-7605, or 828-7518.
Thank you, Jay. Doc, I wanted to ask about your reaction, if you had a comment or any thoughts on the Catholic schools kind of migrating back to online. And when we interviewed Father Val about it, he had basically said that even though there was no evidence of transmission at the school level, that the high case counts had alarmed him so much that he felt it was responsible to move the kids back to online, because he had said he wanted to lessen any opportunity for transmission. Did you have any thoughts on that?
Well, I think organizations have to do what they think is best for their particular situation, right? So, it might help to maybe slow down some of the cases that might arise from the school. And I was also thinking it might be that a lot of their faculty is infected, so they may not have enough staff, and that might be part of the reason that drove them to do that. I don't know. I personally don't know.
I'll tell you, though, he did say that he was anticipating that they would get to that level where there would be so many staff that are sick, so that was one of the factors. Even though they're not there yet, he was saying, like, with the cases, it's just a matter of time, right? So what about public schools, right? So when you look at the Catholic school organization, much smaller than the public schools, but if they're thinking, hey, let's just time out and, kind of like dial back a little bit, I know a lot of public school parents are kind of anticipating like a similar reaction, or some type of like reassuring message that, yeah, it's okay, we had 61 student cases the other day, but it's going to be okay, right? I'm just not sure if these video addresses really soothe a lot of these anxieties that people have, because they haven't made that mental shift that you guys want us to make.
It is for parents, it's really a difficult time, I have to say, and I feel for them. But again, we have to do what's best for the particular group or the particular school, and right, and then that's how it is. I mean, we have to adapt as quickly as this virus, if not quicker.
Last question I had, Jay. I don't know if you had anything, but
Well, I have one if we have time.
okay.
Yeah.
Yeah. Dr. Berg, in an interview with Nestor, he threw out this date of February 1st, and he said, with a little luck, this thing could burn out by February 1st.
I hope so. I mean, aren't you tired of this thing? I mean, we've been talking about this for like what, 2 years now.
That gives us 11 days today.
Like I said yesterday, I wish I had a crystal ball
Right.
to gaze into. But here's the thing: if we can all get vaccinated and boosted, this will end faster rather than late. So in a sense, whether it's February or later, it depends on us, right?
Yeah,
It depends on our community.
I think one thing we learned though, and I mean, regardless of whether Omicron's less severe or more contagious or whatever, it's like every time that we have set a date during this pandemic, whether it's like we're going to open tourism on July 10th or we're going to do this or you know what I mean, it's just gone out the window because of this damn virus. So when he kind of threw that date out there, I was just a little taken aback because I'm tired of like marking my calendar only to have to unmark it or. Go ahead, Jay.
Yeah, Doc, if I may, just on a personal note and everything, like within the epidemiology community, right? Those of you who have dedicated your lives to like study infectious disease, like, did you personally ever think you would see something like this in your lifetime or in your career? And what is it like with, you and your colleagues worldwide just to, to have this now upon you? Because I'm a computer scientist, right? And I remember back in 1999 when the Y2K thing was going to happen, like we're all like, wow, this makes a lot of sense, and we all fixated over it for about 2 months, and then that was that. So what is it like to be in your line of work for the last 2 years?
It was unthinkable. It's like living through history. I never thought this would ever happen, that something of this magnitude and of this duration would be something I would be involved in. I mean, I've worked in. I was in WHO when the first SARS happened, but that was very contained, and that was a really small number of people. And I've worked in tuberculosis in the Philippines in the past, but this is completely mind-blowing, beyond imagination, for sure.
I think that says it all.
Yeah,
Right?
it's a little different from Y2K because I mean, I'm sure that
Exactly.
an opportunity to study something like this is an amazing opportunity for an epidemiologist, but at the same time, obviously, it comes with a heavy price tag.
Absolutely. But you know what the funny thing is? It still comes down to the same core principles of behavior change.
Exactly.
So I want to send there, Doc. What and how do we change our behavior to get out of this?
We take the politics out of this virus. We at some point we just have to trust the scientific community to be the ones to provide the guidance. I think what was really unique about this pandemic is the intentional misinformation that's arisen from the social media. That's the factor that's different from anything I've been involved with in the past. And I think that going forward is something that we will need to address.
Yeah, I mean, it's really the double-edged sword, right? Is technology, a lot of advancements in technology enabled us to spread information faster.
Yeah.
But then the other side of that is it also spreads the misinformation.
I read something about that the other day. They said, like with the Spanish flu of 1918, right? They said that was like the big pandemic of like maybe like the last 120 years or whatever it is. And they said, why now with modern technology and modern techniques and communications, can't we beat something like that faster? And they said, well, we've also got global travel and international commerce and misinformation and everything like that. So it's kind of like
not just misinformation.
offsetting, yeah.
There's so much misinformation, but I think too what we're seeing a lot of is opinion being represented as fact
Sure.
as well.
Exactly.
Which I guess is misinformation.
Yeah.
Okay.
Yeah.
Doc's
You,
always.
you can't get your epidemiology degree from Google, let me tell you that.
How about Ask Jeeves?
Well, if there's anything like I would say like all of us as a society, we probably know like the Greek alphabet like a lot better these days.
Yeah.
That's true.
This is as high as I want to go, though. I don't want to know any more letters of the Greek alphabet.
Exactly.
I didn't sign up for this.
Amen.
Right on.
Well, our community certainly has a weapon against coronavirus, and that's you and Dr. Hampelbutsky and people
Yeah,
like you in your
Jay.
line of work, Doc. So
It's not just me, it's everyone working
Absolutely.
together. Thanks so much, guys.
Thank you, Doc. Have
Thank
a
you
good
for what you do.
weekend. Be
All right.
safer.
Take care
right
now.
on. There you go. Always good. Dr. Annette David. You know what I love about her is you ask her the questions, she'll answer them, and she's very calm in her explanation.
And you can just tell that she's taught before. And like
Yeah.
I said, if you've ever watched one of her lectures, but again, like when she was giving her presentation yesterday, she got very, very animated and borderline aggro.
Wow.